Bismillahirrahmanirrahim. Sayyid Farhad Ali with you. In today's video demonstration, I will show you people in which ways we can position a body for the X-ray. Dr. Islam with me. Welcome, Dr. Islam. He will help me in positioning to show you people how we can position a body. Okay. Actually, there are three ways in which we can position a body. One is the erect position, one is the lying, and other is the halfway between the erect and the lying position. The lying position is called the decubitus position, and the erect is having two further positions. One is standing, other is sitting. Standing, like we are in a standing position, this is erect. Another way, if we sit a patient on the table or on the chair, this is also erect position. So erect two. One is standing, other is sitting. Okay? And decubitus position we will cover in the next lecture. Okay. In the standing, we have, or an erect, we have further three positions. One is PA, posterior anterior, other is AP, anterior posterior, and the third one is lateral. We will start from the PA. Okay, this is the X-ray tube. From here the X-ray will come out. And I will position the Islam for the chest PA. This is the chest PA position. Now I will open the light. Okay, the X-ray is coming out, striking at the posterior aspect of the body. This is the posterior aspect of the body. Okay, then getting into the body and emerging from the anterior. This is the anterior aspect of the body. Here we will consider this one. Emerging from the anterior aspect of the body and finally striking at the receptor or at the detector. This is the posterior anterior. Keep one thing in mind: in the posterior anterior, first we will consider the X-ray tube, but in the oblique position we will consider the detector. So in the posterior anterior, X-ray will come, interact with the posterior aspect of the body, will get into the body, and will come out or emerge from the anterior aspect of the body, and finally it will interact with the detector. Okay, this is the posterior anterior. Now I will show you the anterior posterior position. This is the anterior aspect of the body. I will open the light. The X-ray will come out of the X-ray tube, will interact at the anterior aspect of the body, then will get inside in the body and will emerge from the posterior aspect of the body and will finally interact with the cassette or the detector. This is AP. Another one is the lateral. In the lateral position, the patient will stand in the sidewise, either in the right side or at the left side. That was the trios on the right side, and this is the left side. See, the X-ray tube, the X-ray will come out and will interact at one side of the body, either right side or the left side. This is the lateral. Now we will come again to the PA. Okay, this is the PA basic position. In the PA, we have another two positions. One is right posterior oblique, other is left posterior oblique. Okay, PA. This is PA. But here in the oblique, we will not consider the X-ray tube. We will consider the cassette. The part of the body which is near to the cassette, we will take it first. Now, the patient, which part of the body of the patient is near to the detector? The anterior side. This is the anterior side of the body because the posterior side is near to the X-ray tube. But in the oblique position, we will take the body which is near to the receptor or the detector. So the body is now in the anterior oblique. One is anterior oblique, other is posterior oblique. Now I will cover you anterior oblique. In the anterior oblique, there are two views. One is right anterior oblique, other is left anterior oblique. Now, see, this is the left side of the body, this is the right side of the body. And the anterior side of the body is near to the detector. The right side of the body is attached to the detector, and the left side of the body is far away from the detector. Okay. We will take the side of the body which is near to the detector. First, anterior is near to the detector, other is the right side is attached to the detector. So right anterior, and the patient is not in the anterior position, it is in oblique view. You can see oblique is from the 0 degree to the 90 degree. The angle between from the 0 to the 90, you can see over here. The patient is at some angle. The X-ray will come out, will interact first in the posterior aspect of the body, but as I told you, in the oblique we will not consider the X-ray tube first. We will consider the detector. It will interact at the posterior aspect of the body, will get inside in the body, and will emerge from the anterior aspect of the body, and will finally interact with the image receptor. This is anterior oblique position. But right anterior oblique. Okay, now come to the left anterior oblique. Now, look over here. The left side of the anterior aspect of the body is near to the detector. So we will take first A, not P, anterior. Now, look over here. The right side is attached to the detector or the left side. So the left side is attached to the detector and the right side is at some angle with the detector. So anterior oblique, but left or right? So left. Left anterior oblique. This is left side, this is right side. Left side is attached to the detector and anterior side is near to the detector. This is left anterior oblique, LAO. Covered two positions. One is PA, other is AP. In the AP we covered two views. Left anterior oblique, which we call it LAO, and right anterior oblique. Now we will go for the PA, posterior oblique. And the posterior oblique, as I told you before, the posterior aspect now is near to the detector. So in the oblique we will take the posterior side first, the side which is near to the detector. Now look over here. The posterior side is near to the detector. So P we will take first. Now we will look over here that which side of the body is attached to the detector. Left side or right side. So the right side is attached to the detector and the left side is far away from the detector. So we will take the side which is attached to the detector first. Posterior, right side attached, and this is at some angle. So this is right posterior oblique. This is right posterior oblique. In the right posterior oblique position, the X-ray will come. First will interact at the anterior aspect of the body, then will get inside the body and will come out of the posterior aspect of the body and finally will interact to the receptor. But the body is not straight. It is at some angle. At some angle, that's why we are calling it oblique. This is right and posterior oblique position, not right anterior oblique. Okay. Now another one. Left posterior oblique. And the left posterior oblique, the posterior side is near to the detector, so P we will take first, posterior. Now we will look for which side is near to the receptor or attached to the receptor. This is the right side is far away from the receptor. This is left side is near or attached to the receptor. So we will take posterior and right side, and the body is oblique. So right posterior oblique position. This is right posterior oblique position. We covered two views. One is posterior, other is interior. In the interior we covered right anterior oblique and left anterior oblique, and in the posterior we covered right posterior oblique and left posterior oblique. Now the remaining one is the lateral. The X-rays will enter from the one side of the body and will emerge from other side of the body. Either it will enter at the right side of the body and will emerge at the left side of the body and then will interact with the detector, or the X-rays will first interact with the left side of the body, then will get inside the body and finally will come out of the right side of the body and will interact with the detector. So we have two views in the lateral. One is right lateral, other is left lateral. How we will know which position the patient is in, right lateral or in left lateral? Now look over here. Look over here. This is the right side of the body, this is the left side of the body. I told you only in the PA and in the AP we will first consider the X-ray tube. And all other like oblique and lateral you will consider first the detector. The side of the body which is near to the detector we will take it first. Now here, the left side of the patient is near to the detector or attached to the detector, and the body is in the lateral view because the X is entering at one side of the body and emerging out of the other side of the body. But which side of the body is near to the detector? The left side. So this is left lateral. Okay, left lateral finish. Now come to the right lateral. In the right lateral, the right side of the body will be near to the detector or will attach to the detector, and the patient will come, the X-rays will come at one side, interact with one side of the body, then will get in and will emerge from the other side of the body. But first keep in mind which side of the body is near to the detector. Right side is near to the detector. So right lateral view. In today's lecture we covered three views. One is the posterior, one is the anterior, one is the lateral. In the posterior further we have two views. One is the right posterior oblique, other is the left posterior oblique. Okay. In the anterior further we have two views. One is the left anterior oblique, other is the right anterior oblique. In the lateral we have two views. One is the right lateral, other is the left lateral. Inshallah, in the next video I will explain you people other position rather than that. Thank you so much.